When looking at how do I do a diagnostic ultrasound of the knee, it's definitely one thing to watch a tutorial or watch a video, but actually getting that hands-on practice in class, it brings your skill set to a new level. When you have hands-on training and repetition over and over with experts who are there guiding you through, as a novice or somebody who's new to ultrasound, what am I looking at? Am I identifying the anatomy correctly? Do I have the transducer in the correct plane? Is it longitudinal? Is it short axis? What do I need and why? And do I need both views? Absolutely. These are all things that you're going to learn. So what does the anatomy look like on a tendon in both the long axis and the short axis? What does muscle look like? Why is the bone bright white with a shadow underneath? These are all things that you're going to learn when you attend the hands-on training. Knee diagnostic ultrasound exam. So with this, it's really important to always get two views whenever you're doing a diagnostic exam. So we're going to start with the knee. I think of it as a clock, 12, 3, 6, 9, and you always want to get both views. So to start, I'm going to evaluate the quad tendon. My orientation is towards the pelvis, and with this, when I'm in view, you can see I've got the femur here, bright white line, patella, and this is the quad tendon right here. So the femur, patella, and quad tendon are what you want on your legal landmarks. So once you've obtained that view, then I hold it and just very gently pivot to get the second view, and I'm toggling gently, and that is the cross section of the quad tendon. Next step, I'm going to evaluate the joint space cartilage. So I keep the transducer in place, go ahead and bend the knee and bring your foot up. And with this, I'm holding the transducer here and I'm finding both what look like the humps. And on this, you actually can see, this is the femur right here, the black line just above the bright white line, that's measurable cartilage. So that's something that is really important to point out to the patient, and you want to always get a really nice clean picture. There we go, that's it right there. That is the picture that really educates them, and many patients will make a decision to start care based on that particular picture, measurable cartilage. Okay, next you're either going to pick the medial aspect or the lateral aspect, it's up to you. Whatever you do, you want to be in the habit to always do the same progression. All right, next, if you take the leg and you kind of cut the leg right in half, I'm coming down, you can see the femur, the femoral condyle, and as I'm staying on the middle of the leg, you can actually see just directly under the yellow arrow, you can see the femur is on the left, the tibia is on the right, the break in the middle is the medial meniscus, and right here, the long striations is the MCL. So evaluating, I don't see any fluid leaking out. I don't see the meniscus protruding out. This is a normal medial meniscus and normal MCL. Now that I have that view, I'm going to go ahead and just pivot and turn the transducer to get the cross-section view of the MCL. Finally, on this side, we're doing the lateral view. So you can see the femur, the bright white line. I'm keeping the transducer in the middle of the leg. Now, right where the yellow arrow is, so this is femur, bright white line coming down. Right here in this dip is the popliteal tendon. We want to stay out of that. You can see that little honeycomb shape there. And then as I continue to bring the transducer down, you can actually see this is femur, this is the tibia, and right here in the middle where there's not a bright white line, that is the lateral meniscus right underneath that yellow arrow. The white long striation above it is the LCL. Directly above the LCL is the IT band or iliotibial band. So once you've identified all those structures, you're going to toggle just a little bit, make sure you get a nice clean picture. There we go. One thing you'll be looking for is if they have a meniscus tear, whether it's on the inside or outside of the knee or deeper inside the knee, if there is a tear, fluid would be leaking out. So oftentimes on an ultrasound, I'll actually see fluid leaking out, and it follows the path of least resistance. So in this case, it would go towards the tibia because of gravity. So that's, I don't see that here, but that's something you would be ruling in, ruling out. Now that we have our vertical view, we're going to just switch it and do a cross section of the LCL and IT band right there. And finally, 6 o'clock, we got to check the top of the patella tendon as well as the bottom of the patella tendon. It's important to make sure and view everything into view as well as insertion when you're looking at exam and diagnostics. So right here you can see I've got the patella here, and these long striations is the patella tendon. This is all joint space. As I bring this transducer straight down, you start to see the tibial plateau coming up. I'm staying right in the middle of the knee. Here is the patella tendon attaching here, and this is tibia, patella tendon attachment. Everything looks good there. You would be looking for fluid in the sheath of the tendon. Frequently you'll find Ausgutschlauters right here. Now that I have this view right here, I'm actually going to pivot and get the cross section of my patella tendon. That is a diagnostic ultrasound examination.
Medical providers, you are the heart of healthcare. You are knee to knee, face to face, tear to tear with your patients every single day. At my injection training, my goal is to help answer any questions you may have, to sharpen your skill set to be able to help even more patients. So if there's somebody you know, another medical provider, or there are people you know that could benefit from this, share this video with them, click on our link, go to our website. Our goal is to help you help your community.